I'd like to welcome everybody to today's webinar. This afternoon, we'll hear from our expert child and adolescent psychiatry faculty from the University of Maryland School of Medicine, who will lead a discussion about supporting children, adolescents, and their families during the COVID-19 crisis. They'll share ideas for providing social and emotional support at home, supporting children and adolescents in distance learning, and addressing behavioral health concerns such as anxiety, depression, grief, and trauma. I am Chip Doach, Chairman of the Board of Advisors for the University of Maryland Children's Hospital. And I would like to introduce our panelists. First, Kay Connors is an instructor at the University of Maryland School of Medicine, Executive Director of the Tagi Motoresi Center for Infant Study, Director of the Center of Excellence for Infant and Early Childhood Mental Health, and Maryland ACE Interface Trainer, and Project Director, BNES, DOJ, VOCA, and National Child Traumatic Stress Network Category 3 grants. Next is Dr. Sarah Edwards, who is a board-certified child and adolescent psychiatrist with specialized expertise in early childhood mental health and treatment of complex pediatric trauma-related disorders. She is the medical director of the Child and Adolescent Psychiatry Clinical Service Line at the University of Maryland School of Medicine and the training director of the University of Maryland Child and Adolescent Psychiatry Fellowship. And finally, we have Dr. Sharon Hoover, who is a licensed clinical psychologist and associate professor at the University of Maryland School of Medicine, Division of Child and Adolescent Psychiatry, co-director of the National Center for School Mental Health, and director of the Center for Safe Supportive Schools. So welcome everybody, and I'd open it to our panel at this point.
Thank you so much, and really appreciate the invitation and the welcome. We are going to have a few things to share with you, but we really hope and anticipate that we will make this an interactive experience. So there's a couple of features. I imagine that many of us are familiar with Zoom at this point, since a lot of us are engaging with Zoom, but if you're not, in the lower corner, the lower bar of your screen, there's a chat feature. And we would encourage you to ask questions, make comments, share with each other using that chat feature if you could. We're going to ask a few questions of those who are on the line today, and we'll also share some information with you. So with that, I'm going to go ahead and hand it over to Sarah if you'd like to queue up the video. Sarah, I believe you have to unmute yourself, so you may want to go to the bottom left corner.
Thank you so much, Sharon. Just a quick disclaimer that this is general information and not intended for direct medical advice. And a lot of this content I want to reference two wonderful websites. One is the American Academy of Child and Adolescent Psychiatry, and then also NYU's Hassenfeld Children's Hospital site. Thank you for the lovely introductions, Chip. We appreciate that. And we will get started with this nice little public service announcement that kind of frames what everyone is experiencing.
Hey there, it's me, Louie. I just
Daddy,
want to say,
can you help Elma make a pillow for us,
just a
please?
second, Elma. I'll be right there, son. It is wonderful to get to spend so much time with our children, but can also be a bit overwhelming. But I just wanted to say, parents, you are doing an amazing job. Remember, though, it's important to take some time for yourself. Take care of you. You can listen to your favorite song, stretch, or just take a moment to breathe. Come on, breathe with me right now. Huh? Take a slow, deep breath in. Breathe out. Feels good, huh? We are all doing the best we can, and that is okay. No, it's better than okay. It's
Daddy!
Okay, son, I'm coming. Looks like I have to go. Time to make a pillow fort. You hang in there and keep up the great work.
caring for each other. Visit sesamestreet.org/caring for videos, activities, and tips for the whole family.
It's really a pleasure to be here today with my colleagues from the Home of the Brave. Really admire and respect all the work that my campus and hospital colleagues are doing. And I think this is a perfect moment between Mother's Day and Father's Day just to take a minute to think about you, parents, who really are the front line of the COVID crisis. You're both holding down your jobs, you're taking care of your kids, and you're doing the jobs of teachers and many others. So we really appreciate Sarah starting with that video. And I know we often talk about self-care, but we are really living the essential role of self-care every day, every moment, as we work our way through this crisis. So just thinking about, are you wearing your life jacket? We know that from the research in children's mental health, that children follow your lead. And so taking that moment to both be kind to yourself, to let things go that really aren't that important, and to put things in place that really do work specifically for you and your family, keeping yourself at the center. You're the rightful place in leading your family. What works for others might not work for you all. You know yourself and your family the best. So we just want to kind of start with that message and support you in that work. And also for some of you, you've maybe never reached out to help before. And so just exploring today, what are some of the resources and when you might want to reach out for help for yourself or your family. You know, just thinking, just kind of centering yourself as we start to then explore, you know, your thoughts about your kids. Thinking about where we all started about 60 some days ago. And, you know, fear is a motivating emotion. And it helped us all get toilet paper, supplies, food, not just for ourselves, but our neighbors and our parents. And we were frightened. And when you're afraid, you do things to survive. And I think that's what we all did very well. Sometimes that can have some lingering negative emotions. And so moving into a place where we're trying to learn, and that's certainly where we all are, is we have done remarkable in changing our business practices, changing our home strategies and routines, also learning to live with imperfections like cars honking, kids coming in, cats walking across your computer when you're giving talks, you know. So just starting to be let go of the things that you can't control, and being aware of your own thoughts and feelings, and recognizing and accepting that we're all doing our best, including you, during a difficult time. Now, as we move to this this new phase of recovery and reopening, also thinking about and keeping at the center the ways in which we've all grown, learning how to live in the moment again, as opposed to always planning for the future. But also being able to manage our feelings about fear so that we can live safely in the moment, and also, you know, putting our priorities for the future at the front and center of keeping safe, but also being grateful for our health and safety and all that we've done for ourselves and you've done for your families. So thinking about what your kids need. I know that parents are anxious about how well their kids are doing. And so I just wanted to start with what kids need, and hope that you can recognize that you have and are doing this for your kids. That what kids need at any age is to feel loved and protected. And that is something that everybody has worked very hard to keep their families safe. They also need to understand. So depending on what age they are, they need to understand not only what a coronavirus is, but they need to understand what's happening at the family, school, and community level. one of the 4-year-olds that I work with in our program thought that she had to stay home from school because she had been bad. So really taking the time, her mom being sensitive, taking the time to help her understand that that wasn't why she was staying home, and understanding that everybody was staying home. But for our teenagers, you know, the things that are on their mind are about, rightly so, are about their peers, about their sports team, about their applications to college, the things that they're trying to do in their drama programs, and what does it mean for their future. So helping them to take a step back and understand and find out the information that's going to help with decision making in that and whatever area they need help in. Knowing their feelings, so that's why we started with knowing your feelings, because you're going to help them be clear and give them that space. And Dr. Edwards will talk about a lot of strategies in that area. But also, lastly, feeling capable. We all feel so much stronger when we've been effective, when we've been able to do something, when we've been able to make a difference. And that's true for kids too. So giving them opportunities to help, to be useful, to feel like they can manage in a difficult time is also really important. Take it away, Sarah.
Great. Thank you so much. So as we just heard, we are going to move on and hear about some specific strategies, both for adults and children, to use during this stressful time. And, you know, as we've already talked about, we know that families in many respects have become the de facto educators and even mental health supports for their children, and this can be incredibly complex. I have to say the Elmo, or whichever character that was in the beginning video, really resonated with me as a parent working at home, and the work seems to have increased, not decreased. And I have 3 children at home right now engaged in distance learning, and so it's a constant pull in multiple directions. And so that tug of war that you just illustrated, Kay, I think sometimes we feel like we're pulling and we've got multiple ropes that we're trying to navigate. So one of the questions we wanted to ask of all of you who are on today, and again, we encourage you to use that chat feature at the bottom of your screen, if you would. We'd love for you to, you can introduce yourself if you'd like there, but also we want to hear from you what the most prominent concerns are that you've heard right now from families with respect to navigating COVID-19 with their children. These may be your own concerns, kind of what's your most pressing concern right now and how to navigate this with your children, or just concerns that you've heard as you're working with or engaging with other families. So hopefully some of you will start typing. We'd love to see what your most pressing concerns are, or the concerns you've heard from others, and we'll try to be attentive to that as we're going through some coping strategies. Not seeing any pop up just yet in the chat, and we'll go ahead and move forward. But I would ask the same question of Kay and Sarah. What are the most prominent concerns you've heard from families right now with respect to navigating COVID? And I see one of our participants, Chandra, saying feeling overwhelmed, as if the day doesn't end. Overwhelmed is a word that I've used and heard quite a bit. So I think that's absolutely true. So thank you for modeling that sharing in the chat box. And if somebody doesn't have access to the computer or to a screen and you're only able to share verbally, you are welcome to unmute yourself and to share out loud. Otherwise, Kay, Sarah, any ideas from your end about kind of the most prominent concerns you're hearing from families right now?
I agree very much with the idea that everybody is really struggling and feeling overwhelmed. When is this going to end? I can't do it all. Having so much responsibility, juggling, as you mentioned, Sharon, having to be the teacher and navigate all the systems, especially if you have different age children and their needs, while a lot of people are working parents and trying to do that balance. And so the day never ends, and those feelings that you just really don't have a break.
Yeah. And I'm seeing, Kay, I want to hear from you also. I'm seeing in the chat box how to reassure our families to be cautious but not paralyzed by concern. And I think that the circles that you showed, Kay, were really helpful in helping us think about ourselves and also maybe families we work with. How do we move them from the fear, which can be paralyzing, toward kind of learning and growth? And that can be really, really difficult. And then another comment in the chat, difficulty finding something to look forward to because we don't have a clear endpoint. I think that uncertainty is really complex, both for us as adults, but also for children. It's hard to say, kind of what's coming next. And so it's very hard to feel optimistic sometimes or hopeful. Kay, what have you heard as the most pressing concerns from families right now about navigating COVID with their children?
I think the timeline, not knowing the timeline it's very hard on me, and I'm sure everybody on the line. But how do you explain that to children as it relates to their schoolwork, their summer camps, their sports teams, their other activities?
Yeah.
And then missing special acknowledgments like graduations or the end of the year parties or things like that. So the loss is also something that's very front and forward too.
Yeah, it's really significant. So we're going to hear, go ahead.
Oh, I was just going to piggyback. I think that is a very big topic, is disappointment. And how do we help our children understand disappointment, help them through that and moving forward? So that is definitely a big concern that a lot of families have brought to me.
Mm-hmm. So in this context of feeling overwhelmed and sometimes paralyzed and fearful, we've also seen some great room for optimism, and we've seen some incredible creativity even by families and parents and children alike. Some of them have gone viral even, and they give us all a bit of hope. So we're going to hear some social and emotional strategies that we've encouraged others to use and that many of us have tried to use at home, and some days are better than others. I just want to start there. We know that some days these strategies may work and some days they might not, but we're going to talk through some of these, and so I'll go ahead and pass it back to Dr. Edwards.
Great, thank you. So let's just go back to basics. I think during this time, we all started off, and initially our kids might have thought it was a little bit fun, like an extended vacation, extra Christmas break. And when you have that mindset and you're not sure what's going to happen, I think we lose very basic things. And so one of the most important coping strategies that seems kind of ridiculous that I'm even saying, but it is so important that we just reestablish, if you haven't already, basic routines. Everybody needs this to feel grounded. It helps to reduce stress. And we need to have very specific kind of beginning, middle, end points. We don't have to have a routine or a schedule down to the nanosecond, but so that children and ourselves understand getting up and basic hygiene routines. Some families have shared with me, well, they're in the pajamas all day long, and it's 3 o'clock and they're just brushing their teeth after, quote, breakfast. And so it's really important to go back to that basic routine and making sure that this is what's going to get us feeling better. And then I'm sure there'll be a lot of questions, so I won't get into too many details, but sleep. Sleep's a huge issue right now. Everyone's schedules have shifted a little bit, so I think everyone's up a little bit later. You might even be like watching more TV or movies, sleep up later, then you're sleeping in late. Our teenagers are loving this time because they're allowed and able to sleep in a little bit longer, which is causing some issues as well. But it's so important that you still have that regular sleep routine. We know that we function better, our children develop, they need to have consistent, between 9 and 12 hours of sleep depending on the ages. And that's really, really important. And this can cause some conflict because the families, we know the parents are like, why aren't you in bed yet? And the teenagers are trying to do so chatting with your friends and staying up late, and the screens, the blue light interferes with their sleep as well. So I think kind of coming together as a family and involving everybody in the decision of what is our basic structure of the day going to look like. But you want to have everyone's buy-in, so it's important not just to tell them this is what we're going to do, but ask them, Does this, what can you give on? What can you compromise? What would make sense? I've heard some families who, depending on if they have multiple age children, will shift things to accommodate. So they might let that teenager sleep in a little bit later, and then that morning gives them some one-on-one time with the younger child. So again, working together as a family to develop those. I love this this acronym that one of the clinical psychologists came up with, and it was Dr. Angelo Sante from NYU. And during this time, it's so important to, quote, stay safe. And so if everybody, and you can make sure as a parent that your children also do one of these 4 columns or 4 areas. So the S being for social, we have to have some sort of social interaction. It can be something as basic as making sure you called a friend that day, or played games, or spent a little bit of social time with, speaking outside to the neighbor who's appropriately distanced. Active, staying active. I think that we take for granted how much you kind of move around when you're just going to your daily job, or kids at school. So kids are walking the hallways all the time. Those little steps here and there add up. And right now, if you're in your house, you typically have decreased amount of just normal steps and getting up instead of sitting down in front of a computer for most of the day. So families have come up with some creative ideas. Dancing around, dance parties, dance breaks, YouTube, there's all the different videos, and there's ways to make it fun. And then that is our next acronym, excuse me, which is, it's not COVID, it's allergies. Looking at something to do for yourself that's fun, reading. For you, it might be reading a book, or the kids a puzzle, board games, just something that you yourself find enjoyable. And then we also have to put some effort into our day. So that could be schoolwork for the kids, for you, your typical work, kind of coming off your checklist, doing something like that, some sort of chores. And if everybody can do each one of these 4, you'll have and feel so much more successful in your daily routine. And it'll make you feel a lot better to positively impact your mood. And so super important. Just having fun. I think because it has been so stressful, as you're juggling, everyone's a little bit on edge, a little bit more anxious. Kind of coming back to that basic idea of there are ways and times in which we can get together. A lot of times asking, especially if you have teenagers, can I play a video game with you? Or can I watch what video you're watching? Trying to join them in an activity that they like. And then you can laugh and have fun together. The weather's finally, is very nice. We've been lucky with that. To go outside, to play, throw the ball, frisbee, different ways. Have those reasonable expectations about screen time. And I'm assuming we'll probably get more questions about some of those building parameters and boundaries around screen time. But really, this is a time where people have done a great job coming together, and we want to make it as fun. Take, just a moment a day. It doesn't have to take a lot, but to remember to enjoy each other as a family. Plenty of different mindfulness, relaxation, and I will open this up to my colleagues as well. I did want to highlight one app that we have found very successful, even for younger children. It's called Smiling Mind. I have no financial, I think it's a nonprofit. It's free to download. It's a really nice free program. And it walks you through what parts you would like to work on, whether or not that's becoming more successful in tasks or meditation, mindfulness, or on mindful eating. It has a lot of questions that'll help you kind of hone in on different ways that'll help you. So that's just one idea, or one app that people have found successful. And I'd like to hear from Sharon and Kay about other mindfulness and relaxation techniques that enjoy.
Well, I'll just share that in the chat box, I put a workbook, and it actually has a really user-friendly kind of guide and some tools and worksheets for adults and children to work through together. It's really geared toward more of the elementary school age. We also have a number of resources for younger children, and I know Kay would be familiar with those and can share some, as well as some of our older students. So I agree that the mindfulness and relaxation piece can be useful, and some of our teens can share the apps that they use. I know that Headspace and Calm are some of our teens' favorites in high schools where we work. Okay.
For the youngest kids in your families, I'll post 0 to 3's resources. So they have wonderful COVID-related resources that really map onto some of the things that Dr. Edwards was saying. And I did notice that someone had asked about people with PTSD. There is a very good free app called PTSD Coach, and it's developed by the National Center for PTSD. So I highly recommend that for people that are trying to manage their PTSD symptoms.
One of the resources I just shared that was put together by Kay and her colleagues is a sharing of books for kids that can help families walk through COVID-19 and some of the associated concerns and strategies. So I've put that in the chat box as well, and I see that Kay just shared the 0 to 3.
One of the things I'd like to highlight is that sometimes when people talk about, well, you need to be more mindful or do yoga, it almost seems like more pressure, like, okay, how am I supposed to be the teacher and be a worker, and then, oh yes, by the way, let me do yoga when I'm exhausted and I can't barely, keep my eyes open. And so to kind of reframe things that this doesn't mean that you have to do this 45-minute yoga class. It's about finding those few, sometimes even just moments, seconds, can be minutes, spending an extra 5 minutes in a warm shower or bath if that works for you. Being outside, I've had some colleagues who share that they really need to transition their workday to the family day by saying, I'm going on a walk right now. And that is their way to kind of prepare before they get into the more family responsibilities. And so it's just, this isn't more pressure to place on ourselves. It's how do we help ourselves in these little moment by moment opportunities, finding what can work for you. The biggest, if I had one take-home point right now, because I know that families are close quarters, squabbling a lot, having teenagers, young ones being very sensitive, lots of high emotions going on. Biggest coping strategy is that we as families and parents, we need to be able to listen to our children and then validate. And I know it sounds really easy, but it's actually hard to do. So we need to be able to, an example of a middle schooler coming, screaming because you asked them to put away the dishes, and why are you being so unfair to them? And can't you see that they're stressed out, they're missing their friends, they didn't get a chance to do the party, the recital that was supposed to happen. Give them that opportunity to share their feelings and listen without any judgment. Try not to interrupt, provide some alternative viewpoints. Try not to reassure, like, well, I know prom was a big deal, but it's really not that big of a deal because look what's happening in the world. That's not what a child needs to hear during this time. They need to feel like they are truly being heard and validated. Now's not the time when they're in the heat of the moment to be talking about, this is hard, and Frank had to, think about people who really had to suffer, you have it easy. No, you need to let them just completely be able to keep talking and expressing what they're, listen to what they're saying, and then let them know that, validate by saying, like, you hear them, and that sounds challenging, hard, and also express how you are very supportive by how they are handling it. So it sounds like it's been really hard to not be with your friends right now, and definitely it's very disappointing that you can't have the end of the year party you were looking towards. But I'm so proud of how you have been able to still be with us, here, you're doing your schoolwork, show that support that for the things that they are doing well. Because we're all doing things right and things and struggling in other areas. So making sure that you can express that back to So listen, 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 and validate those feelings.
So I'd love for folks to share in the chat box what their kind of best social emotional support strategy has been with your own children, or one that you've heard about. If you have a resource to share, you're welcome to share that as well. But if you have a strategy that you feel like worked, or something that you've thought was particularly creative or helpful, please put that into the chat box. I also want to note that a question came in about how COVID affected trauma issues being treated at UMS and shock trauma. And I'll pass that on to my colleagues, but first just want to respond from the school's perspective, since that's where all of our work resides, really, for my work particularly. And I can say that, the schools are not only currently really thinking about the psychological trauma that the students and families are experiencing, but also the anticipated kind of need for the school counselors and social workers and psychologists and community mental health providers to be prepared with evidence-based treatment for trauma, for example. So the psychological traumas that students are going to come with, both in the form of kind of grief and loss for some of the rituals and routines that were disrupted, but also for the loss of family and friends and the sense of community. So there's lots of different ways that loss has played out, and we anticipate a need to prepare our workforce in terms of that response when schools reopen, but even now. So I'd go ahead and pass on, maybe Dr. Edwards, if you have a sense of how COVID has affected trauma issues being treated at UMS and shock trauma.
That's a great question. Actually, our numbers, at least from a consultation standpoint, have increased in the shock trauma area. I don't know if their total volume has decreased during this COVID time, if people aren't out and about, and so there's less traumatic events and accidents happening. But I think our hospital has really done a nice job of being able to support not only families and individuals that are dealing with this, but our healthcare workers who are really dealing with a lot of traumatic issues. They are, besides dealing with COVID themselves, but coming to work and seeing a lot of scary things. The hospital has been extremely supportive of making sure that they're showing a lot of gratitude towards the staff, and having lots of little impromptu gratitude parties, lots of, sharing. Sometimes we get snacks and food. And so I felt like that has really helped to lessen a little bit of the overall trauma. We are ready and taking a lot of referrals in our mental health clinic, and our inpatient child unit is open. And so I feel the hospital has really done a nice job being able to handle that. I don't know, Kate, if you want to speak a little bit specifically to some of the other PTSD.
One of the things I would just kind of keep in mind, and it relates to the talking points that Sarah just shared, is to really be open and listen carefully to what is the traumatic experience for those patients. And so, as a family member, we would probably be so grateful that there was a medical intervention that saved our loved ones' lives, and not always be open to hearing from them how frightening the intervention was, and some of the worries that they have kind of ongoing about, their throat and the tubes that had to go down, or their breathing. And so I have noticed that people with health conditions and people that have had medical intervention, even though it's life-saving, have very intense worries about getting sick and the impact of the virus. So just keeping an open mind, even though it is even frightening to think about it.
So two of our participants commented on some of the social emotional strategies that have been most useful. One mentioned trying to think of the top 10 positive unintended consequences. And I imagine we're talking about the consequences of COVID-19. I know this is a discussion we've had at home and then amongst our colleagues, most certainly. And so talking with children about these can be fun in some ways, and they come up with some really interesting ideas. One that comes up a lot are the unexpected maybe consequences for the environment, and kind of a recognition of what does happen when everyone stops commuting, or when public transit slows down or stops flying, that kind of thing. And then some of the discussions in our community about the consequence of kind of a raised awareness of inequities in access to quality healthcare and education. And also the implications or consequences for the healthcare and education fields more broadly, and are there positive or silver linings with that, has been a big topic of conversation, like the advancement of telehealth and reimbursement models for that. But I love that suggestion of having this kind of open conversation with your kids even about the top 10 unintended consequences. And then we heard from Chandra, who said that a portion of your work is school counseling, and that you recently facilitated social skills lessons, one on gratitude and another on resilience, with K through 5 via Zoom. That must have been fun. And you said the open discussion, read aloud, and follow up was productive and therapeutic. One of my concerns is that we will possibly experience ongoing trauma to some extent, those who are more at risk and others. And I think we all would agree with you, Chandra, that this is not a short-lived experience for individuals or communities. There was a really good article that just came out. I think the title was "The Kids Are Not Okay," but they drew on some of the lessons we learned with other community crises like Hurricanes Katrina and Rita, and the longitudinal data that really demonstrated the significant impact and trauma that is experienced years out. We heard from another participant about positive affirmations. What did I accomplish today? I think that's awesome, just to ask ourselves, what did I accomplish? And it may be that you got out of bed and were able to get your children fed for the day. That can feel like the biggest accomplishment. I had to laugh at the recommendation about pajamas. With my teenagers, pajama bottoms have become acceptable attire as long as they shower and have a routine. So, we all choose our battles, I think, and asking yourself what you accomplished and giving yourself and your children positive affirmations is really helpful. And Chandra mentioned during social skills lesson, we completed an ABC gratitude chart, A for air, B for bread, etc. I love it. So really creative ideas that you're sharing. Thank you, everyone, for sharing your ideas. This is a really important time for us to learn from each other. So we did want to move on to talk just a little bit about young people with mental health concerns. And, we know that many parents of children with mental health concerns have expressed distress, for example, at trying to meet the demands of distance learning while also trying to manage their children's mental health issues, which may be exacerbated by what they're experiencing right now with distancing. So we want to hear from Dr. Edwards and from all of you about some effective strategies that you've seen for supporting families and young people with mental health concerns right now, and also hear a little bit about kind of how we can help identify students who may be particularly struggling and then support them. So I'll go ahead and pass it on to Dr. Edwards.
Sure, thank you. Yeah, so the next couple of slides, we're going to just kind of talk about, I think a lot of times for parents, it has been so stressful. So how do you know this is just normal reaction to the stress and disappointment and loss that we've all been experiencing? Or when do you start to worry that maybe it's something more that in my child I'm starting to see, and that it really could be something like depression? I just want to see a couple slides on that and some take points, and then we'll definitely open it up to more conversation and questions.
And I'm just going to interject for one moment. I think a couple of folks are unmuted and there's a bit of background noise. If you're able to go to the bottom left corner of your screen, you should see a mute button, and you can press that. Or if you're just calling in via phone and you could mute your phone, that would be helpful. And the host can also mute all participants, I believe. So those are all of our options right now, but go ahead, take it away.
Sure, thank you. I'm not going to list every criteria for youth depression, but these are some highlights that I'd like to talk about. When to start becoming concerned about your child is if they start suddenly being very socially withdrawn, if there is a difference you've noticed in their interest in typical activities that they like to do, you're going to see kids who are a little bit moodier during this time because of the stress, but we're talking about extremes. And in all of this, we're talking about really a change in their baseline. One of the important things to worry about is when you start seeing kids completely isolate, shut down, and at any point they start talking about death or expressing a lot of interest in death, or saying things like, I wish I was dead, I never should have been born, I'm such a burden on you. Those are the concerning statements that make you want to take a little bit of pause. And so we look at the 4 Ds. So is differentiating something that's a negative mood from true clinical depression. And so we're looking for that dysfunction and the distress. So this is really impacting the schoolwork done, and that they themselves are experiencing a lot of issues with the symptoms. It needs to be a change from their baseline. You know your children best, and this is not my kid anymore. There's a big difference. And it needs to have happened, you know, pervasive most of the day for several weeks. You know, full criteria is for a 2-week time period. But really look at how is this impairing their function. So if you notice that it's a deviance from who my child is, and they're stressed, and it's lasting most of the day, every day, and it's causing this dysfunction, that's when you want to seek guidance from your healthcare provider. You know, you can start with or you can and try to seek out a mental health provider as well. A question that I often people will ask me is, how do I talk about this with our children? Can you help us figure out when is the best time to do this? And that's a really important framework, right? You got to choose the best time. This is not when you want to start asking about their mood when they're doing something really fun. And then conversely, it's never a good time after there's been some sort of disagreement or argument. It's important that you kind of just stick to the facts and then describe this very specific behaviors that you find concerning and ask them if they've noticed that. You know, so something like, I've noticed that you're not participating in the Zoom chat sessions anymore with a group of friends. You used to do it every Sunday at 3 o'clock and you haven't been doing it for a while. You know, have you noticed that you're not doing this? So giving very specific behaviors. Validate, let them know how hard things have been and kind of be able to express concern for their well-being. Sometimes sharing can be very powerful. So if you know somebody who's experienced depression, or even you yourself, you got to be a little bit careful because it really needs to be about your child and not yourself. But that link to kind of destigmatize any sort of issues with talking about mood, depression, mental health, it could be a very powerful tool. And then just be ready for the outcomes. So this conversation might go poorly, and that's okay. And they might react really strongly, but be ready. Or, you know, a lot of times it really doesn't, and it goes well. And they appreciate you noticing and feeling that you're giving that extra effort and that you care. And so this is kind of the framework that we recommend when you start asking your children, youth about mood, or when you start having concerns. Just wanted to open that up to both Kay and Sharon if you wanted to talk a little bit more, or we can also start moving into some distance learning tips.
I guess I would just punctuate the point that Dr. Edwards made about, you know, finding the words to talk about difficult things and how powerful that can be to making connections with your kids. And there's kind of a famous quote from Mr. Rogers, Fred Rogers, that says, if it's mentionable, it's manageable. And I think those are the kind of things I keep in my mind when I'm feeling less than brave about bringing up difficult things.
Checking with Sharon, any comments from the chat box?
The only thing that I'm seeing at this moment is just a question about the muting. And I appreciate one of the participants mentioned we're trying to mute ourselves, but aren't sure if we're doing it right. If you can hear us, please let us know. So what I can say is it appears that maybe 2 people are unmuted, but I'm not hearing anything at the current moment. So thank you so much to everybody for muting yourselves. I know the tech can be a little challenging and it's hard to know if you're muted or unmuted. If you are on screen and you go to the bottom left corner and you see the microphone, if it's white and has green coming into it, it's probably not muted.
Oh, Sharon, you muted right now.
My goodness, that was that. As I tried to demonstrate, I I muted myself. Wow. Okay. So Kay, thank you for sharing that. If it's mentionable, it's manageable. It's one of my favorite quotes to think about as we talk about things with children and try to really attune developmentally to where they are. So I think we can go ahead and talk through some of the support during distance learning, because as we've already mentioned, this is one of the most challenging things that we're hearing from educators and from parents alike, and from students as well, that this is really novel and unfamiliar, which often moves us to the fear zone that Kay talked about earlier very quickly, and it's hard to move away from that. So let's hear about how to support this distance learning effort.
Sure, I'm happy to continue, but please, Sharon, I know with your school mental health experience, and you've been doing a lot of webinars with teachers, so you're going to have a lot of ideas as well, so please pipe in as you can. I just kind of try to break it down into some age groups, so I'm not sure on the call how many people have preschoolers, elementary versus teenagers, and young adults, right? We have a lot of transitional age college youth back in the house as well. So preschoolers, I think, really important is to try to keep up that reading, try to read at least twice a day, make it fun, have books around you so that they have access to books. You can do lots of games that you turn them into learning activities. So somebody told me that they were lining up bowling pins, and then they had sight words on them, and as soon as you roll a ball and knock down the pins, in order when you pick it up, have the child read the sight word. So that's one little activity. That's a way that it's fun and engaging, but it doesn't feel like sitting down and practicing reading out sight words over and over again. So you want to keep, for young kids, to increase their vocabulary, keep labeling everything you're doing as you talk with them, practicing alphabet numbers. And then for their physical aspect, make obstacle courses. You can put tape around all around on the carpet, on the floor, and make fun things. Kids love that. They absolutely love, starting an obstacle course. Pillow forts. Yeah, it's at the very beginning that Elmo's dad was being pulled away to make pillow forts. And I do think pillow forts is something that elementary kids really get into. Middle school kids will even join in as well. It's kind of a fun thing. Looking towards the elementary age kids, try to figure out what that schedule is and working with them and continue to increase reading. This is where we have to do a little give and take, right? So kids might still be interested in reading, but some are just not having it right now. So how do you be a little bit flexible? You could try still allowing graphic novels or kids magazines. So having a little bit of that give and take. I do think for elementary school age kids, it's important to have kind of the just right reading level books for them. If it's something too hard, they might get frustrated. And then conversely, if it's something that's a little bit too easy, they're just like, why am I doing this? So trying to figure that out, and always being able to email your this teacher in case you need a little bit of help. They can recommend what books would work with your child and their reading level. It doesn't always have to just be about schoolwork. I think we can have ideas like having different family members teach a skill. I know through Zoom sessions, a lot of grandparents are teaching their grandchildren how to bake. And there's lots of math and measurement within baking, cooking, gardening. You could look up online how to plant a flower, whatever, and go ahead and do that. So there's different ways to still keep learning and all that behavioral activation that we talked about, because this is good for their learning, their brains, and it's also going to have a really positive impact on their mood. Middle schoolers, read. Please try to read. Might have to be flexible and even do audiobooks, but that's better than not at all. Giving them some space. They're on that journey towards more autonomy. So you don't have to be hovering over them. And you can work together, decide, well, how frequently will I check in about your schoolwork? You know your kids best. You might have a kid where they get all their work done, you never have to worry. Or you might your child might be somebody that you check in a little bit more frequently. But if you agree to, I will check in with you at the end of the day, that, have that buy-in from the child, and that'll give you a way to make sure they're getting the work done, but then they don't feel like you're just hovering. And lastly, with teenagers, this has definitely been a really hard time for teens. They're missing, their whole developmental task is to be a social being right now. That's the evolutionary drive of this age group. And they're missing that. So helping to reinforce connecting them virtually, even within the work, there's a lot of Zoom features where you can have small groups. So maybe if you know that they're doing X number of assignments, and that this group of friends together, you can set them up and have a virtual room where they're just working on that together. Also give them that independence and space. If you need to check in, kind of come together to figure out how frequently that they think it's acceptable and that it's not annoying them. And that part's really important. I do think it's been challenging on everybody, but the teens, so many important rites of passage, prom, not going to your senior prom, graduation, things that to adults struggling with some other real, bigger issues might seem trivial. It's really so important to them. So to be able to give that language, to let them discuss that disappointment, and then to help them go ahead and validate their feelings and help them through that. So those are just some quick little tips. I'd love to hear what Sharon has in your lots of webinars recently, what other great ones you've had.
So a couple of quick things I want to say, and then I actually want to address a really good question that came up in the chat box about young children and distance learning. So one thing that we kind of use as a mantra when we think about the current situation, but really this is always, is number one is health and safety, and number two is academics and instruction. And that's in part because we know that children really can't access the learning environment unless they're healthy and safe, and that includes mental health. And so part of the reason I say that is because these are great tips in terms of kind of how to support distance learning, but probably first and foremost, we want to be sure that we're being compassionate with ourselves and our own well-being. We may not be able to, nor should we be expected to learn a whole new math system overnight to support our middle schooler, and then the reading system and the Common Core, whatever it is. It's really almost an impossibility for families right now. So have some self-compassion as well as compassion for your children, given all of the concerns that Dr. Edwards just mentioned. So I want to turn this question to Kay, who is our resident expert on early childhood. And the question is, if young toddlers aren't interested in Zoom calls with their class or teachers, shall we skip them, or do we keep encouraging them? For the most part, the toddler refuses to engage on the calls. And I think you're not alone in this experience, and I'd love to hear what Kay has to say.
Yeah. I want to just back up one point just to augment what Sharon was saying, is that I kind of think about, I know that parents, including parents of very young kids, worry about their kids falling behind, and kind of think about it like nature, like we've seen a lot of healing, in the environment, and kids will do the same, like as Sharon said, if we focus on their health and well-being, they will catch up, and we'll learn some new strategies even to catch them up. So for little kids, as it relates to those interactions, I do think, having, especially if the child is going to go back to that program, or, they are really talking about and wondering about school. So if you see them, playing school, playing teacher, definitely encourage that. And that, then you can know that they're holding their teacher in their mind. And that is a powerful and wonderful wonderful thing. I think, probably daily connections might be too hard for toddlers. But a touch, what we would like to call touch points, can be really helpful. So 0 to 3, and I'll post this, has a wonderful kind of 5 tips about successful video chats. So one, if it's just 2 minutes, that's more than enough for little kids. So make it interactive. One of the things I find really interesting about this time is how we're going back to old-fashioned things like peekaboo, riding bikes in the neighborhood, all the things that actually in the busyness of pre-COVID life, there wasn't a lot of time for. So just go back to some of those things that use props, puppets, stuffed animals, little finger puppets or little paper dolls, can also be a way to play virtually. And have different kinds of symbols, all done is kind of Sarah's point about the beginning, middle, and end, like we're all done now. So giving signals for that, but also heartfelt signals, about how, since you can't hug virtually, or finding symbols that would help you hug virtually, blowing kisses. And, when things don't go well, like you can't hear well, or, technology gets in the way, just try to explain the best you can.
One kind of rule to keep in mind, or principle to keep in mind, is that when children are highly distressed, so if they're really struggling with the Zoom or whatever, they're using the emotional part of their brain and not so much the thinking part of their brain. And so they're not going to be able to learn if it's a highly distressing situation. So the really simple answer is, if they're really struggling emotionally with the technology, they're probably not in a good place to learn. In terms of their readiness at that moment to learn. But I love the strategies that you mentioned, Kay. I'm recognizing we have a minute left, and so Sarah, I wonder if you could close us out with some thoughts about moving forward in terms of this theme of resilience and optimism moving forward.
Absolutely. Before I do that, I would like to just point out, I advanced the one slide, and I think this is really important. Parents, we have a lot of pressure on ourselves, and I think we framed this whole thing about making sure that we also take a moment and take care of ourselves. And so sometimes, especially with this schooling, we get really frustrated and down on ourselves. He wasn't able to sit through the Zoom course for 15 minutes, and you only sat for 2 minutes. And so I want to caution everybody not to gauge your own kind of daily success based on your child's outcomes, whether or not they get their work done or what their grade was, but instead to really measure by looking at how you've interacted with your children that day. Did you do the right thing? Were you able to give that positive praise? Ignore the negative behaviors, kind of let them have the meltdown, and you didn't engage in that battle. Were you able to validate their feelings? If you can look back at your day and say, I've done this with my child, then it's a successful day, rather than getting down on yourself because they got to be on that assignment. This is something to carry forward pre-COVID, after COVID. It's an important lesson that I think sometimes as parents we're so busy that we lose sight. As far as with, yes, we're moving forward, and we can take these times to really remind ourselves and others that it's not going to last forever. Things are changing. This disappointment's an opportunity for us to remain strong and build resilient skills, and to tap into memories and experiences with your stories about you and your family, and how your strengths and how you've already tackled hard times and gotten through them, and that you will be able to do this as well. So I know I probably have 1 minute or 0 minutes left, and I'll let Sharon.
I think Chip has come on screen, so I'll pass the torch. I know one of the questions is there a recording available? I know we can make the slides available, but thank you so much on behalf of all of our team, and I'll go ahead and pass it to Chip to close out.
Thank you, Sharon, very much. Just certainly want to thank all of you today for your valuable input and perspective. I think everybody's been shaken a little bit off balance, and it's nice to find some resources that'll help people of all ages, not just kids, but everybody. So thank you guys for all your time. I'd like to thank Kay Connors, Dr. Edwards, and Dr. Hoover for sharing their expertise, and I'd like to thank our listeners for today's session too. I hope everybody's family stays safe and healthy and well in the months ahead. Thank you all.
Thank you. Take
Thank you
care.
very much.